So hi, it's me, Dopey Keller from I-LOTUS Acupuncture, and welcome to the TCM community. I'm joined today by our special guest, Dr. Wang. He is the academic dean of the Dutch Acupuncture Academy and senior advisor of the European Academy of Traditional Chinese Medicine and strategic advisor of the Dutch Chinese Medicine Association, ZONG. He's also an executive member of ETCMA. He has a long list of credentials. We won't be able to cover that. Otherwise, we'll still be here tomorrow. So welcome, Dr. Wang.
Thank you, Adobe. Thank you
And
for having me.
it's my pleasure. And specifically today, we're talking about, because you're the academic dean of the DAA, the Dutch Acupuncture Academy. When was this established? Since when is the Dutch Academy up and running?
Actually, it is from the establishment. It's a pretty a new school. It's only 2 years, with joined by a few very senior TCM lecturers together. So this is a new school for this title in Dutch Acupuncture Academy. But if you look at the history, it's based on the European school of this traditional medicine. So it has been around since 2008. And
Okay.
all of our lectures have been giving lectures in the other schools in China, university in China, in other schools in European countries, including the Netherlands. So over 20, 30 years. So basically, the title of the school is new, but the all main organs inside the school is a pretty long history.
Okay. Yes, I saw the list of lecturers. It's a very impressive list.
Thank you. Yeah,
And
indeed.
yeah, some of them I know is they're all specialized in different fields of TCM. And so let's say I have no knowledge of TCM and I want to enroll at the DAA. What can I expect? Can I go online? Where can I find it?
Yeah, I think it's if you don't know first, probably you get to know us a little bit. You can go to a website. Our website is called the www.daa.academy. So you have all of the information over there. So I think it is a very simple but clear website for all of the necessary informations you can find there.
Okay, and so what opportunities can you provide students? For example, with the current COVID situation, how are you dealing? Do you have online classes or is it all physical classes?
Yeah, actually, we are one of the schools starts with hybrid education. So consider of the whole situation of the COVID-19, maybe in the future, even the pandemic ends up, we still think it's some of the lectures is possible to let the students to spend their study hour time at home, and with the lectures give a virtual but vivid live educations lectures. So, but some of the education, it is a must. You have to do a physical education, like traditional education at the school. So for us, it's the first school in the Netherlands to offer this hybrid education.
Okay, and then is it a fixed percentage of hybrid online versus physical?
And
Or is
actually,
it,
it's we yeah, indeed, we have accreditation from SNRO. Maybe you know that. I'm sure this is
yes?
accreditation from the Dutch alternative medicine part for the institutes of SNRO. So the percentage it is get accredited with different years and different speciality. You have a different percentage. For example, for the first year as a foundation of Chinese medicine, you spend more times talking about the history of Chinese medicine, the basic knowledge, the yin yang five elements, etc. This kind of information, so it gives more possibilities to be taught via online. But there are some other knowledges like tongue diagnosis, pulse diagnosis with palpation of different part, how to feel the body, how to make the basic physical exam. So these are not possible to do it virtually. So we still have certain weekends for the face-to-face education. And for acupuncture, for example, like a first year, you have to do locating of the acupoints, how to put the needles. This kind of education is not possible to do it online. So we have more a percentage of face-to-face education. So in general, it depends on different years.
Okay, and speaking of weekends, it is in 10 weekends, right? The course is Saturday and Sunday.
Yes, that's every month you have one weekend, Saturday and Sunday. For a year, it's 10 weekends education. So it is
Okay,
for one discipline, it's 3 years education.
yep. And you cover everything. So foundations, acupuncture 1, 2, you have herbal medicine 1, 2.
Yes, we
And
cover the education, what we get accreditations, and we offer the education is including the different discipline, acupuncture, Pena, and herbal medicine.
okay. Do you also provide, let's say, clinical apprenticeships within the school, or do you have to go like external apprenticeships?
Yeah, indeed, this is in my personal opinion, and I've been working now, I think 18 years in Netherlands. So as being 6 years president of Dutch TCM Association. So basically, I know most of the schools, or not to be arrogant, all of the schools, basically their structure of education here. So I think this is one of the biggest concern for the education of Chinese medicine in Netherlands. So I think the other schools also have good lectures, and so I realize this is a shortage. So that's the reason we put, since the day one, we start to set up this school of the education structure. This is one of my biggest attention and concerns. We need to put more time for the education of clinical practice and practical apprenticeship. So this is not only the hours the students have to finish that only for the graduation, but it is necessary, it is beneficial for them to learn all of these experiences practically before they really can start their practice. So we put a lot of efforts. So one of the things you may want to know, many students from other complaining, we cannot find the proper apprenticeship
Right.
advisors,
Mhm.
But for us, we want to use the knowledge and experience of our lectures. So all of our students will follow our lectures to have clinical practice for apprenticeship.
Okay, so the students can do clinical apprenticeships at the lecturers that are associated with the DAA.
Indeed, indeed.
Okay, and the emphasis is like a heavy emphasis on clinical practice.
Absolutely, and also additionally, we put more efforts for the internal apprenticeship. So we will
Okay.
set up a new way of studying practically. So students will come together with a small group with
Oh,
knife
that's great.
patients. So the
Yeah.
patients will be overviewed by one of the lecturers, just supervise them to give hand-to-hand education. So it's
Yeah.
a hands-on education. Exactly. Right now, I don't think the other schools can
No.
they offer or able to offer this education. Indeed.
No. And this all will take place then at the location of the school, which is in Harlem, right?
Yeah,
Right.
the main education is the school, but then also we have to adjust according to the small groups, so we can may happens in one of the practice of the lectures can be in Den Haag, can be in Amsterdam, for example.
And the interaction between school and student is you go through like an administration, right? It's through email.
There is a possibility to, if some people really want to communicate with one of the teachers, with the study coordinators, even with one of the directors, we will set up this very direct education. We want to set up basically one-to-one contacts. That means the students from the day one step into the day we try to set up one-to-one connections between students and one of the lectures. Maybe it will take a few weekends before the students may choose one of the lectures, but this is a general structure. So that means in the following 3 years, if you only study acupuncture, or maybe 5 years or 6 years, if you are going to study Tena or herbal medicine, etc. So you will have a mentor. So one of the lectures will be your mentor. So always keep this direct online of communication.
That's more in line with the traditional Chinese way of studying TCM. You have a mentor and you follow your mentor.
Yeah, indeed. Traditionally, it's just like a shifu, with your master and the students. So we try to combine with traditional way in this modern society education of Chinese medicine.
What about if there are students that are interested, for example, that don't live in Holland, let's say Belgium or Germany?
Yeah, we do already have the contacts with other school. Not only Belgium and Germany, they're nearby. We have students from Poland, from Croatia, from Lithuania. So for those students, I think online is not a problem, but face to face is a challenge. But we informed them honestly. But surprisingly, the students they don't mind to make efforts to make the trip come to Netherlands for face-to-face education.
So you already have foreign students, and if it wasn't for the pandemic, everything would be fine. Just online lectures, and then they come over for the physical lectures.
Yes, indeed. And also we are see the other opportunities. For example, if the country like from Iceland or from Slovenia, if there are quite a small group of students, like a few students from the same area. So we are discussing another possibility. We can send one of the lectures to there for the locational education instead of all 5-6 students come to Netherlands.
So you're very flexible. DAA is super flexible.
And on one hand, we are flexible. On the other hand, we are not flexible. So I think for the education part, how to approach communication with the students, I think we are super flexible. But for the quality of the education, we are not flexible at all. We are very stiff.
It's a high standard. Yeah.
And I mean, all of these lectures, we are, we are very successful practitioners. I think everyone. So we know, and the knowledge and experience should be shared. So otherwise, we wouldn't come together to set up this new school, because we don't want to keep on frustrating with the system, which we don't think is the correct way to deliver the TCM knowledge and experiences. So that's the reason a group of us, we work together, we come together for the same goal, which is we don't want to narrow down the education of the TCM medicine,
Also, not only a lot of fantastic practitioners, but also authors of many books that I've read, like Dr. Palin Sun. Really, I have most of his books. Really,
very, very practical, very impressive. Yes, indeed.
I mean, for me, it's I already finished, but it would be nice to have lectures from some of the professors at your academy.
Nice to hear.
And what about maybe in the future, like more specialistic courses, or maybe you have them already? Like if you finished acupuncture or herbal medicine already, are there more coming up?
Actually, for DA, we offer two kinds of education. I mean, as you know, if you want to be acupuncturist, or if you want to be a Tena therapist or herbalist, this is called basic educations to be a practitioner of Chinese medicine. If you have finished that, we also organize postgraduate educations. So for the special diseases, for example, we have organized in the past year. We have organized a few times of seminars to teach the practitioners in Netherlands, actually in Europe, how to use the Chinese medicine, use acupuncture to help these people who suffer from COVID-19, for example. We also see more and more people who suffered, who had infection of the COVID-19, they still have quite some aftermath, some leftover symptoms, syndromes. They cannot really recover thoroughly from the disease. So we are also working on that part to give postgraduate seminars, workshops, for the students who finished the basic education.
These postgraduate educations, they're all also accredited for NVA, Zong, for example.
Yeah, of course. This is we have a very close and a very good relationship with both organizations, even more in Netherlands, and also we have a good contact with the University of Chinese Medicine in Nanjing, as you know that. So we
Yeah.
also organized a travel to Nanjing before a few years, but due to the pandemic, it's stopped. And also we will work further for the postgraduate for master PhD education in the future. So that's our next goal. But right now, for this year, next year, I think mostly we focus on the basic education of acupuncture, trainer therapy, and herbal medicine. What makes the DAA different from other school? I would say the quality, because you can see most of our lectures are educated in China, and we were educated as medical doctors in China, and most of us were professors from Chinese university. So, which is makes a difference because we know the quality of education makes difference from for the students who are going to study here and graduate from. So we focus on though the situation in Netherlands, when you study, finish the study, and then you become a therapist, you cannot call yourself doctor. But for us, it is doctor. It is a medical practice. So we don't think it should be in that way. I mean, you educate people, help some of the symptoms of the patients, focus on relieve the symptoms. No, we focus on educate our students to be medical professional. I think this is our goal. Is different,
and that's why the emphasis is so heavy on academics and also if that is your end goal, focusing on being a medical professional, heavy on academics, of course that will raise the quality of the education.
Indeed, that's what some students before they register, they already ask, do you think we can after 3 years study, I can graduate? I said, I cannot tell. It's up to you, not up to me. Because definitely, I don't think we are the, if you talk about flexibility, we are flexible, as I said, that to connect with students, to communicate with students, but we are not flexible on the quality. So
yes.
If you study hard, you follow our instructions, for sure you will reach there, because we want to, as I always said, today, if you're a student of you will feel proud of the school. And then tomorrow, when you graduate from the school will feel proud of you, because you are a successful medical professional.
See, I miss these Dr. Wang pep talks.
Thank you.
What I was thinking about just now is, do you also provide the mandatory Western medicine if you want to start a practice in Holland? Or do the students have to look for it elsewhere?
Yeah, we don't offer the Western medicine, MBK education here, but we do have cooperating schools for that part. So our students, they will get our refer to the
so you can guide them. Yeah, okay.
Indeed, because in Netherlands there are more than enough schools who
there are a lot.
offer this education. They are not. There are many schools. Some of them are really good. So we have a close cooperation with them.
So even though you're not yourself providing it, you're focusing more on the TCM side. You do have relations, and you know where the best ones are, so you can guide your students to find those best ones, because like you said, there are a lot of them out there.
Indeed, that's our one of our principles. We do what we know what we are doing. So we don't do the things which it's not our not special. Though we are all mostly all of the lectures, we are all medical doctors, but to give education here for the empirical part is related with even the Dutch legislation of medicine part, with a psychological part, with ethnics, medical ethnics. So that's not our strength for education.
Mm-hmm.
So I prefer not to do that. We prefer to work together to cooperate with the other special schools.
Yeah, I think I don't have any more questions. It's very clear.
I think we covered everything. So thank you very much for your interview. I hope we can cooperate further in the future.
My pleasure, Dr. Wang. Yes, for certain, we should cooperate and in the future. You know, I always want to educate myself more, so I'll be watching the DAA.
Sorry, I don't think you should watch in the DAA. You should grow together with DAA.
Very well put, TCM wise. Okay, thank you, Dr. Wang. And
Okay.
that's it for now, guys. We'll see you next time on the TCM community. I'm Dopey Keller from I-LOTUS, and see you next time. Bye.
Bye.